And start recording. You're called code 2 for a lift assist with weakness. Just you guys. Go.
We'll arrive on scene.
You arrive at a small apartment on the second floor of an elderly living community. The neighbor's outside frantically waving, and she shows you to the door.
Any scene safety hazards?
No. It's about 8:45 in the morning, on a clear, crisp morning, and everyone's just doing their old lady things. Okay. You walk inside, you find the patient as you see them sitting on the floor. There's an obvious odor of urine and feces. Your patient is approximately 350 pounds and appears to be in her mid-60s.
All right, when we see the patient, are they tracking us?
Nope.
Okay.
Her skin is extremely pale and diaphoretic.
Is the patient breathing?
Yes, she is breathing.
All right, and look in the airway, do you see any obstructions?
Nope.
Okay, I'm going to have my partner ask for an engine to respond, code 3.
Okay.
For additional manpower.
Fire department's en route, code 3. We'll be here in 6 minutes.
Okay, gonna try to get a response from the patient on the sternal rib. Any response?
She groans.
That's it.
She groans as what?
Okay, I'm gonna try to talk to the patient, ask her what's going on, why we called today.
She cannot really answer your questions.
Okay, feeling for a radial pulse. Do I have one?
No.
Okay. Carotid pulse.
Very weak at about 40.
About 40. All right, so I have my partner put the patient on the monitor with the pads. I'm also going to put patient on high flow oxygen.
Give me the 3 as well. Okay, patient's on high flow O2. Your partner is turning on the monitor.
Okay, and can I... I'm going to have my partner get an IV.
Okay. Oh, Jesus. Don't look at the monitor.
Okay. I take the patient's blood pressure.
Okay, go for it. It's all real time, so as soon as you're done, I'll tell you. (76/40).
Okay.
Not get this thing. So ignore these little things, like that thing and that thing. Whatever you think that is, just ignore that. And there's a rhythm.
All right, so the patient's in a...
Oh, it's on pace mode. That's why. Let's turn it on monitor mode there. Or it's on DFID mode, isn't it?
Yeah, I know this.
Right. Okay. There is your rhythm.
Okay. So the patient's in a 3rd degree heart block.
Okay.
So we already have the pads on. We're going to switch to the pacer mode
Okay.
and start pacing the patient.
Sharps out.
Go ahead and walk me through how you pace the patient.
We already have the pads on. I'm going to set the rate to 70 and increase our milliamps until we see electrical capture.
You have electrical capture.
Okay. We're going to confirm do we have mechanical capture.
You sure do.
Okay. Is the patient tolerating the pacing? Do you appear to be any distress from it?
Yeah, she's tolerating it. She just says, I feel weak. being applied.
Applied.
Okay.
What is the screw to?
Now it's doing its thing. It's coming up. Real world. Starts at 68. Starts to come up a little bit. Now it says 94.
Okay. Is fire on scene yet?
Nope.
Okay. So I'd like to rapidly transport this patient, but because of the patient's size, I don't think the two of us can extricate them without more assistance. So we're gonna wait for fire to get on scene.
Okay.
What is the patient's blood pressure?
80/42.
Okay. We're gonna do a fluid challenge with normal saline. We're going to run that wide open.
Okay.
Recheck our blood pressure after we've done 250 milliliters.
Okay.
Is fire on scene yet?
Nope.
Okay. Has our patient's mentation improved at all?
She's able to talk to you.
Okay. Partner, can you get lung sounds? Gonna talk to the patient, ask her what's going on.
I don't know, I just feel weak. I don't know how long I've been on the floor.
Okay. Does she remember falling at all?
No, I don't remember falling. I remember waking up this morning. I usually go water my flowers, but I didn't make it, I guess.
Are there any signs of trauma looking at the patient's head and neck?
Nope.
What are my lung sounds?
Clear in the upper lobes and slight rills in the lower lobes.
Alright. Does the patient have any previous medical history that you can tell us about?
We have a heart failure, and I got the sugar and the high blood pressure, and I got a zapper in my chest.
Okay.
Did we see any pedal edema?
Negative fetal.
Does the patient have a medication list?
It's on the counter over there.
The neighbor says she'll go grab it.
Okay. What is on it?
Okay, if I mispronounce these, forgive me. Lasix, HCTZ, Atenolol, Crestor, Vicodin, Ativan, Metformin, Humalog, Novolog, Paxil, Effexor, Celexa, and Abilify.
Okay. Is the patient having any shortness of breath? Feel like that at all? Or any chest pain?
No, I just feel really weak.
Okay. What's our blood pressure? We recycle that.
84/48.
Okay.
Hey guys, fire department, what's going on?
Alright. We need you guys to help us pick this patient up and get her on our gurney.
Okay. You want us to bring the gurney upstairs?
Let's grab a stair chair.
No, let's do the mega mover.
Okay.
Okay, we're gonna make a mover down the stairs?
Yeah.
Okay. We'll go get the beef boys from the truck. Alright, fire department's here. How you gonna get on the mega mover?
She's in this position.
Yep. 350.
We can just do a slight roll, shove it underneath, and then roll back and
Okay.
pull her on that way.
Okay, yeah, you have her on the mega mover and you guys are...
We're gonna do a four-person lift down the stairs.
Okay.
And put her on the
You're
gurney.
gonna keep her on the monitor while you do that?
We're gonna keep her on the monitor.
Okay. Alright, yeah, you got her on the gurney and loading her into the ambulance, I'm assuming?
Yeah.
Okay, you're in the back of the ambulance.
Alright, we're gonna start.
Gonna go drive.
I'm gonna have my partner stay in the back with me and fire drive.
Firefighter would like to know where you wanna go and if you can use the lights.
Yeah, we're gonna go code 3 to the, with our options.
St. Joe's or Mad River?
And we're in Eureka.
No, you're in Trinidad.
Alright, we're gonna go code 3 to St. Joe's.
Okay. Your firefighter's driving 85. You got about a 10-minute ETA.
I'm gonna reconfirm that we still have mechanical capture.
Affirmative.
Okay. And that fluid's still going. Is our patient's blood pressure still the same if I cycle it again? Have it on Q5?
You have administered about 100 milliliters so far
Okay.
in about 4 minutes. Her blood pressure is 84 over 38.
Alright, we're gonna do a 12 lead. Apply those stickers and then pause the pacing momentarily to try to get a 12 lead.
Sorry, what?
We're gonna do a 12 lead.
Okay.
If I find I could put the leads on.
Go ahead and simulate moving her excess adipose tissue out of the way to do the 12 lead. Your partner's still messing with the stickers. They're not really sticking that well to her skin because she's dyed for it.
Get a towel and wipe that up a little bit.
All right, 12 lead is initializing, reading. Okay, your 12 lead shows a paced rhythm.
Alright, we're gonna pause the pacer momentarily to get to the 12 lead.
Okay. Your 12 lead shows a 3rd degree heart block.
Alright, any ST elevation?
Nope.
Okay.
A 3rd degree heart block at a rate of 40. Your patient passes out.
Alright, we're gonna resume the pacing.
Okay.
Do we have mechanical capture again?
You do.
Alright. And our patient's still unresponsive?
She is now unresponsive, yeah. Yep.
Okay.
Unresponsive to painful stimuli.
Nope, she's totally unresponsive.
Alright,
she
is the
still
patient,
have
is the patient still breathing?
She is still breathing.
Does she still have a pulse?
She still has a pulse.
What is her respiratory rate?
Her respiratory rate is 28.
And she's still 95%?
Now she's at 90.
Is her breathing labored?
Yes.
Alright, we can start try and do assisted ventilation to the bag. Will she accept OPA?
Yes, she will.
Okay. I'm gonna place that.
You can lay the mannequin flat if you want to. All right, your ventilations are going in swimmingly.
Okay. Is that improving her oxygenation?
Yep.
Alright, what's her blood pressure?
Blood pressure is now 78 over 38.
Okay. We're gonna do start a pressor on her. I'm gonna do an epi drip at
Okay.
10 micrograms per minute.
Okay, go ahead and set that up.
I'm gonna grab another bag of saline that we have. And push my preload into that. And set it for 10 micrograms per minute, which is 100 drops per minute with 10 drop tubing.
Okay.
Then recheck her blood pressure.
Yeah, your blood pressure's unchanged. You just started the drip.
Okay.
You have an ETA of 3 minutes to the hospital.
Alright, I'll call the radio report.
Go ahead with your radio report, St. Joe's.
St. Joe's, Arcata 2, Code 3, medical.
Okay. Go ahead.
your facility. Code 3 with approximately 80-year-old female. Chief complaint of altered level of consciousness. Rather than seeing to find the patient in a third-degree heart block, we're currently pacing the patient with mechanical capture. Patient is unresponsive GCS of 3 with a BLS airway. Blood pressure 72/60. We're at 95% on high flow oxygen, and we'll be at your facility in 3 minutes. Do you have any questions?
Copy that. Bed assignment upon arrival. St. Joe's out.
All right.
All right. Is there anything else you'd like to do for this patient before you arrive at St. Joe's?
No, I'm just going to continue to monitor our interventions.
Okay. You want to end the scenario?
Yeah.
Okay. Scenario end.